are back with Dr. Kimberly Newton with the Cone Health Center for Women's Healthcare. So we talked about some physical well-being. Let's talk about the emotional well-being after you give birth as well, and what kind of things change and what women need to know and what steps to take.
Absolutely. And I think that this is one of the things that often we're not talking about well. So I'm so glad I have this opportunity to talk about it. So, in terms of emotional wellness and mental health after delivery of a baby, it is really normal to have a lot of ups and downs. You can go from 1 minute crying in a shower, the next minute overjoyed and just filled with joyful experiences. And I think what I like to tell people is that in the first 2 weeks, that is really normal. These are the big hormonal shifts after delivery of a baby. If those symptoms are persisting after that 2 weeks, we really want to be talking to you about it. There are a lot of things that can still be normal, but we want to make sure that we're helping people navigate this emotional roller coaster at times of what is the postpartum period or after birth. The other thing that I like to let anyone I'm caring for know is that sometimes when we as the human are going through it, we don't see how much we are suffering or how different we are. And sometimes it is a spouse, it is a partner, it is our best friend, it is our coworker who says, "Hey, Kim, you're not the person, you're not acting the way that I know you to be." And I want us all to say, okay, they're not judging me, they just really love me and care about me. And that should prompt you to come and talk to your midwife, your doctor, and say, "Hey, these are things that people who love me are saying. And I don't know if that's right. I don't know what's going on." We are the safe place to come with all of those thoughts because it is a really hard time. And it's incredibly common that women will, up to 30% of people, 30 out of 100, experience postpartum anxiety and depression. And we should be talking about that more. And we want
Yeah.
to talk about it more.
Yeah, and I imagine a strong support system is something that is necessary as well. What advice do you have for friends and family of someone with a newborn, the do's and the don'ts?
Oh my gosh, that's a great question. So, the big thing that you do want to do is support that birthing parent. And when they ask you to do something, do it. And when they ask you to not do something, don't do it. I think that the other thing that I say is like food is always supportive. I'm Italian, so like food means love, but food can be really helpful when you're taking care of a newborn and you don't know if you're going to have time to cook your next meal. So that's where our systems of support, our churches, our community, our village can really help out. Additionally, sometimes our partners and our spouses, they see that we are really, that someone is real, the birthing parent is really struggling. They are physically healing, they're emotionally healing. Sometimes they're breastfeeding as well. And really, that person who loves the birthing person so much doesn't know how to help. And so I think just really saying, okay, what are the primary needs? I need to eat. I need to have shelter. I need to have comfort. And those are the things that our community can really help us with. And also I say, go over and help that birthing parent with no expectation of holding that baby, because sometimes all they want to do is hold the baby and rest and not worry about the laundry, not worry about the kitchen, not worry about the older sibling that's really wanting their attention. Or
Right.
they want you to hold the baby so you can take the other sibling to the park. They can do that and be the parent they want to be for both of their children or all of
Yeah.
their children.
Be willing to be flexible for whatever it is that they need. I want to make sure that
Yeah.
we get this question in before we go. A lot of breastfeeding can be challenging for moms. So for nursing moms, what advice do you have?
Well, I always tell people take it one day at a time, and that breastfeeding is something that both you, as the birthing parent, and your baby are learning to do. And sometimes that happens, oh, chef's kiss, so well. And sometimes it takes a little bit to get to learn those skills. And we have support systems. We have a wonderful lactation team at Cone Health that can help you, but also your care providers. If things aren't going, you're not reaching your breastfeeding goals, but take it one day at a time, one nurse at a time. And I sometimes tell people, don't stop breastfeeding on a bad day. Stop it on a day when you felt content with how it went, because that will help you regardless of where in your journey you are.
Okay. Any final thoughts about the importance of prioritizing your health during the fourth trimester after the birth of the baby?
Well, what I always want any patient I talk to know is that when you are pregnant, you're almost like this piece of candy. You're the wrapper for the candy. And then the candy comes out, and you can feel like the wrapper that's left in the trash. And I don't want anyone who births in our community to feel that way, because we care about you. Your health matters, your mental health matters, your physical health matters. And we are here to listen to you and be with you for the joy and with you in the struggle as well.
All right. Well, we thank you for your time and your expertise and kind of encapsulating that whole mom plus baby combined care. If you'd like to maybe send this to someone else, maybe there's a new mom, or maybe there's a circle of friends that you're going to be supporting that new mom. Everybody needs to listen to this. This is going to be in the To Your Wellbeing section of our website. Right now,